Then lumbar plexus, sacral, and coccygeal. Lumbar plexus. Lumbar plexus is in front of transverse processes of the lumbar vertebra, behind of this muscle. What is this muscle?
Psoas
major.
Behind of psoas major, and it gives muscular branches, rami muscularis, which supplies psoas major. If we have psoas minor, the same, quadratus lumborum, musculi intertransversari lateralis lumborum. Impossible to see. Now, another branches leaves lumbar plexus laterally from psoas major through thickness of this muscle, one nerve, and one nerve medially. First of all, laterally from psoas major. 1 minute. Look here. This is subcostal nerve. Do you remember we have 12 intercostal, and last 12 nerve is subcostal. And below from it we can see first nerve from lumbar plexus, that is iliohypogastric nerve. This nerve goes to lateral muscles. They are transversus abdominal muscle, external oblique, internal oblique abdominal muscle, and after that it goes under the skin and supplies skin of the abdomen above of inguinal ligament. Next nerve, ilioinguinal nerve, nervus ilioinguinalis. It also supplies lateral muscles. Then it leaves abdominal cavity through superficial inguinal ring and goes to the skin of the scrotum or to the skin of labia pudenzi major. They are nervi scrotalis anterioris or nervi labialis anterioris. Next nerve, that is cutaneous nerve, nervus cutaneus femoris lateralis, this one. This nerve leaves abdominal cavity below of spina iliaca anterior superior and descend on the thigh, on the lateral aspect of the thigh, and supplies it. Nervus cutaneus femoris lateralis. Next nerve, and it is largest nerve of the lumbar plexus, femoral nerve. Femoral nerve, it passes below of inguinal ligament. If you remember, space under the inguinal ligament subdivides into two lacunae. Lacuna musculorum and lacuna vasorum. And nerve leaves together with iliopsoas muscle through lacuna musculorum. This is femoral nerve. And it gives muscular branches for anterior muscles of the thigh. They are quadriceps, musculus,
tensor fascia,
musculus,
sartorius,
and part of this muscle. Who remember what is this muscle? Musculus pectineus. Part of pectineal muscle.
Biceps femoris.
The same femoral nerve supplies skin on anterior aspect of the thigh and gives longest branch. It is nervus saphenus. Nervus saphenus, that is cutaneous nerve, which goes into the canal. Who remember what is the name of this canal?
Canalis femoris.
No, femoral canal in normal is absent. Only in femoral hernia we can see femoral. But in normal we can see canalis adductorius. Canalis adductorius. And this nerve, nervus saphenus, in canalis adductorius, it perforates anterior wall of this canal, that is lamina vasta adductoria, comes under the skin and subdivides into nervi infrapatellaris, supplies skin below of patella, and rami cutanei cruris medialis, and supplies skin of the leg, lower leg, and goes to medial aspect of the foot. That is nervus saphenus, longest branch of femoral nerve. Next nerve from lumbar plexus. This nerve passes through thickness of musculus psoas major. This is genitofemoral nerve, nervus genitofemoralis.
Femoralis.
And this nerve gives two branches, one of them ramus femoralis and ramus genitalis, genital and femoral. Ramus femoralis, femoral branch, passes below of inguinal ligament and supplies skin of the thigh below of inguinal ligament, and ramus genitalis goes into inguinal canal attached to spermatic cord and descend with spermatic cord into the scrotum and supplies coats of the testes and testes. That is genital branch, ramus genitalis. And last nerve of the lumbar plexus, it is nervus obturatorius. Nervus obturatorius. It passes medially from psoas major, nervus obturatorius. Then it leaves pelvis through canalis obturatorius. This is, and on the thigh, it supplies musculus, part of this muscle, together with femoral nerve, musculus pectineus, musculus adductor longus, musculus adductor brevis, musculus adductor magnus, only anterior part of this muscle. The same it supplies musculus gracilis. It gives branch for hip joint and supplies skin above of medial muscles, medial aspect of the thigh. Well, it was lumbar plexus. Lumbar plexus forms with the help of rami ventralis of upper fourth lumbar nerves. Fifth lumbar and four sacral nerves makes sacral plexus, and the same branch from fourth lumbar also continues into sacral plexus, and fifth sacral and one coccygeal nerve makes coccygeal plexus, and coccygeal plexus gives nervi ana coccygeal and supplies a region near of anus. That is all about sacral plexus. About coccygeal plexus. And sacral plexus, that is the largest plexus in human body, it gives short and long branches. Short branches we try to see on the model, and now here on the corp we will see long branches of sacral plexus. Long branches of sacral plexus, only two nerves. They are nervus cutaneus femoris posterior. It is clear that it supplies skin of the thigh. The same, it goes to upper region of the leg and supplies skin here, and also it gives nervi cluneum inferior cluneal nerve. Do you remember? Yes. Superior and middle. Yes. From rami dorsalis of lumbar nerves we have nervi cluneum superior. From rami dorsalis of sacral nerves nervi cluneum medii, and from nervus cutaneus femoris posterior nervi cluneum inferior. That is first nerve, and second, that is sciatic nerve. It is largest nerve in the human body. Sciatic nerve, nervus ischiaticus, very large nerve, nervus ischiaticus. Here it is. This is sciatic nerve, nervus ischiaticus. It leaves pelvis through infrapiriform foramen. It passes below of gluteus maximus muscle, goes to posterior surface of the thigh, and here supplies posterior muscles. They are musculus tendinosus, then semi-membranosus, then only long head of biceps femoris, only long head of biceps, and posterior aspect of musculus adductor magnus. Musculus adductor magnus posterior. Anterior side, if you remember, nervus obturatorius, and posterior side, nervus ischiaticus. After that, nervus sciaticus subdivides into
2, 3.
two main branches. They are nervus tibialis, tibial nerve, and common peroneal nerve, nervus peroneus communis. Tibial and common peroneal nerve. Tibial nerve goes to popliteal fossa, and here in popliteal fossa, tibial nerve, it has most superficial position. Under the skin, we can see tibial nerve. Below of tibial nerve, that is middle position in popliteal vein, and deepest position in popliteal fossa in popliteal artery. Artery deepest, nerve superficially, and between them popliteal vein. And now, which branches it gives? Tibial nerve, in upper part it gives nervus cutaneus sure medialis, and then it goes, leaves popliteal fossa, sorry, and goes into the canal. Canalis, who remember? Crura popliteus, yes. Yes, muscles you know better than brachial plexus. Goes to crura-popliteal canal, and okay, this is tibial nerve, nervus tibialis, and this canal, crura-popliteal canal, between musculus soleus and musculus tibialis posterior. In this canal, it supplies gastrocnemius muscle, soleus muscle. Here it is absent musculus plantaris, plantar muscle, and gives deep branch. It is nervus interosseus cruris, and this interosseal nerve, it supplies musculus flexor digitorum longus, musculus tibialis posterior, and musculus flexor hallucis longus. All deep muscles supplied by nervus interosseus cruris. Next, tibial nerve, it surrounds malleolus medialis, goes to plantar surface of the foot, and here in plantar surface it subdivides into two branches. Nervus plantaris medialis, and should be here nervus plantaris lateralis. Medial nerve, nervus plantaris medialis, it supplies all medial muscles except adductor hallucis and lateral head of flexor hallucis brevis. The same it supplies first and second musculus lumbricalis. And this nerve, nervus plantaris medialis, subdivides into three common plantar digital nerves, nervi digitalis plantaris communis, and they gives
2 fingers, like
how many?
toe, 1 toe,
Three common nerves.
and they give 7
Seven
proper now.
proper plantar digital nerves. Nervi digitalis plantaris propri, and supplies first, second, third, and medial side of the fourth toe.
Yes.
Clear? The same like what? Like nervus medianus on the hand. And lateral nerve, nervus plantaris lateralis, the same like ulnar nerve. It gives two, superficial and deep. Superficial, here it is, one moment, superficial nerve gives two common plantar digital, and these two common gives three proper plantar digital nerves. And deep branch supplies all the other muscles. The same like ulnar nerve on the hand. Next it is common peroneal nerve, nervus peroneus communis. Nervus peroneus communis, it goes into the canal, canalis muscule peroneus superior, between long peroneal muscle and fibula. Do you remember inferior canal, canalis muscule peroneus inferior, and what passes through this canal? Only which artery? Peroneal artery, very good. Arteria peronea or fibular, it is the same. Arteria peronea, it goes to canalis muscule peroneus inferior, and superior canal has common peroneal nerve. Before this canal, from common peroneal nerve start nervus cutaneus sure lateralis. It is broken here, impossible to see. And these two nerves, lateral, sural nerve, nervus cutaneus sure lateralis from common peroneal, and nervus cutaneus sure medialis from tibial nerve, and nervus cutaneus sure medialis from tibial. They join together, and together they form one nerve, nervus suralis. Nervus suralis, it surrounds a lateral ankle and goes to lateral side of the foot and continues into nervus cutaneus dorsalis lateralis and supplies lateral side of the foot and lateral side of little finger. Nervus cutaneus dorsalis lateralis, it is continuation of nervus suralis. Now, what happened with common peroneal nerve? I move.
હવે કેટલાય પડખા પડતા છે રાતે.
Common peroneal nerve subdivides into two branches, nervus peroneus superficialis and nervus peroneus profundus. And superficial nerve leaves canal, canalis musculi peroneus superior, this is superficial branch, nervus peroneus superficialis. It supplies musculus peroneus longus and musculus peroneus brevis. And then it subdivides into two cutaneous branches, nervus cutaneus dorsalis medialis and nervus cutaneus dorsalis intermedius. Because lateral nerve we already have.
Yes.
If you remember, nervus suralis continues into nervus cutaneus dorsalis lateralis, and superficial nerve gives cutaneus dorsalis medialis and cutaneus dorsalis intermedialis. In a minute I draw a diagram how this nerve supplies fingers, and now deep peroneal nerve. Deep nerve, nervus peroneus profundus, it supplies anterior muscles. They are musculus tibialis anterior, musculus extensor hallucis longus, musculus extensor digitorum longus. Then it goes to the foot, and here it supplies musculus extensor digitorum brevis and musculus extensor hallucis brevis, and subdivides into two terminal branches, nervi digitalis dorsalis, and goes to opposite sides of the first and second toe. That is all.